Hey everyone, it's Dr. David here. Nice to see you all here live with me on YouTube. We've got an excellent topic here. We're going to talk about if you need a hip replacement or not. I'm going to cover the top 5 signs that I've developed here for determining if you need a hip replacement or not. Now, this isn't designed, this information is not supposed to replace going to go visit your doctor and going through the, the formal process of everything. But it's some great information, a good starting points to decide on your own at home if you should go to the doctor, if there's a chance that it's going to get better. And by the time we're done here, I'll be able to walk you through all the different signs, and you should be able to decide if you need to go to the doctor right away, or if it's or you need to stop and wait, or what you should do next as well. I'll be talking about that too. And then also type in the chat here if you can hear me. Just say hello in the chat. Tell me where you're from. That'd be really nice too. And then if you have any other questions, whether or not it's related to hip problems, jump in on the chat as well and leave us a question, and I'll get back to you on that. So I've got about 15 to 20 minutes or so before I got to get back to patients here, and I hope to have a good time with you here. So let's get into it. This whole topic comes from somebody that commented on our video. His name is Cesar Perez, and he said, "What is your sign when hip replacement is needed?" That's what he said and how he said it. And so the number one sign, these aren't like in urgency order. This is just the first one, so they're not in a particular order. The number one sign that you need a hip replacement is that you have a loss of motion in your hip joint. And the way this looks, the way that you can tell on yourself if you've got a loss of motion, I'm going to just tip the camera down here so you can see my hips. If you pull one knee towards your chest, and this is your good knee, your knee that feels okay, and it doesn't bother you in the hip, but the other side, it just doesn't go as far. This side goes this far, and this side just doesn't go that far. And it might even start to hurt in the hip joint right here. Then you have a loss of motion in your hip joint. And what this is a sign of is that your hip joint surfaces, the ball and socket of the hip joint here, are not moving the way that they should because there's some bony block inside the joint here. So the ball sits inside the socket and should be able to move in there smoothly. But if you can't go the full range of motion, you're blocked somehow, it's a sign that you've been getting too much pressure in the hip joint over time, and it's starting to block you from going through your full range of motion. Hey, Michael M., thanks for chiming in. Hello from Georgia. We're in Texas. Howdy from Texas. So related to the first sign is hip joint locking. That's the second sign. If your hip joint locks, and the way this looks and feels is, it's not just you probably already have a limitation of motion, but your hip joint gets stuck. Like you're moving along, and then all of a sudden your hip gets stuck in this position, and your other one can move just fine, but it's painful to get out of this position. Your hip wants to stay right here, or vice versa. It might get stuck straight, and you can't quite bend it one way, or you can't rotate it either. It just doesn't. It stays stuck in this position. You can't quite get it to free up. Most people will kind of shake their leg loose a bit. It's painful. They have to hold on to something for balance, and then after a few minutes, they can free it up. In extreme cases, they're going to the hospital, and that's when they're getting an MRI or X-ray and finding out that they've got severe hip arthritis. That's what sets up having to get a hip replacement. So that was number 2, hip joint locking. Go back to my notes here. All right, number 3 is not being able to tolerate walking or being on your feet, standing for more than about 10 minutes at a time. Even shorter than that, like 5 minutes. The more severe it is, the less time you're going to be able to tolerate standing. So if you've been up on your feet to wake up in the morning, you go cook a meal, you go to the bathroom, and after 10 minutes or so, you're just like, I need to sit down. Or if you go out to the store and you find that you're leaning on the shopping cart quite a bit, or using the motorized scooter, and you can't tolerate being on your feet for very long, that's another big sign that you've got some severe hip arthritis. Now, it could just be flared up hip arthritis. It may be that you can flare it down and make it better. But if that consistently happens to you, and that's been going on for some time, like more than 3 months, then there's a high likelihood that inside that ball and socket joint of the hip, you've got some bony changes that a hip replacement might benefit. You might benefit from getting a hip replacement for that. All right, let's go on to number 4 here, and chime in with questions, please, if you have any questions. about this topic, getting a hip replacement, or any other topics. All right, number 4 is getting pain at night. So having night pain, especially if you're getting it every single night, then that is not a good thing. That means that your hip joint is very flared up. If you can't flare it down, Pastor Winnie, I'll answer your question about flaring it down. If you can't flare that hip pain down, then your hip joint is the surfaces are so not smooth or rough that you're getting pain even at night. Oftentimes, pain medication just barely takes the edge off. It's waking people up at night, and they can't get comfortable. They're having to toss and turn. Lying on the side that's bothersome is usually very uncomfortable, and they just are miserable at night. If that's you, that's a high sign, a high likelihood sign that you're going to benefit a lot from having a hip replacement. Now, one more sign I'm going to talk about here, and this is the most important one in my opinion. If your hip does not respond to exercise, if you go try out exercises and your hip actually feels better, then that's a good thing. You have a shot at possibly improving these other 4 signs, getting your motion back, preventing it from locking so much, sleeping better at night, and tolerating being on your feet more. But if you've tried exercises specifically for the glutes and other exercises we recommend, in fact, I've linked a video down in the description below that has the top 4 exercises to start with if you've got hip arthritis. Go try those exercises out, give them a good go. If you have not benefited from them, like you haven't felt a smidge better whatsoever, please go get a hip replacement. You have got a hip joint that's so arthritic that it's probably not going to benefit much from exercise. And if you've been having trouble standing on your feet, sleeping at night, all the stuff that I mentioned, loss of motion, you're probably going to benefit tremendously. It's going to be a life-changing experience for you to get that hip replacement. Now, hopefully everything goes well in your hip replacement. Nothing bad happens. And the good side is they are good at doing hip replacements these days. Significantly better than even just 10 or 20 years ago, and tremendously better than 30 or 40 years ago. So if you do have to if you do have to go get a hip replacement, you're actually not in a bad position. But I would still highly recommend doing those exercises that I mentioned in the comments below so that you can improve your chances of recovering faster afterwards, and then addressing the root problem. Because the root problem here with having to get a hip replacement is that you've got hip arthritis. Your hip joint's been getting pressurized too much because of muscle imbalances, and you got to go start fixing those muscle imbalances in order to properly depressurize the hip joint and load it the way that it's intended to, the way that it's supposed to be loaded. So I hope that helps out. If you need to rewind and go back and check those signs that I talked about, those are pretty solid ones. And of course, like I said, go see your doctor if you're thinking you need a hip replacement, get an x-ray, get an MRI. It's not the whole picture though. The doctor typically takes this much time with you and they're not asking you how it is at home. Because if you have instances where you feel great, where you actually stand up and you can walk okay, you sleep through the night, you're not in constant pain, you have times where you're not that bad, then you might be able to get away without having a hip replacement, and you don't want to jump into it. Even if you go to the doctor and they give you an MRI or an x-ray and they tell you that your hip joint's bone on bone or that you have severe arthritis, you might be able to do just fine if you do the right things to flare it down and allow the cartilage inside your ball and socket joint of your hip to heal. So that being said, let's get to the questions here. Pastor Winnie had the very appropriate question here. How do you flare it down? Excellent question. Cartilage inside the hip joint is usually what's flared up here, the tissue that's flared up. And that's because of that excessive pressure. So you got to take pressure off the hip joint. Number one thing you have to do is get off your feet and minimize how much you're doing so that you can allow the cartilage to not be pressurized so much. Now, fixing the muscle imbalance would be the next step, but you're not going to look at doing that until you can tolerate sleeping better at night, being able to walk on your feet for longer periods of time, and locking less in your hip. Once you get to that point, then you're in a better shape to go start exercising aggressively to strengthen the right muscles and begin to allow that cartilage to heal fully. So that process can take anywhere from a couple of weeks to several months, maybe even the better part of a year, like more than 6 months. But it really is different from person to person, depending on their specific activity, their physical activity. Like, do you have stairs in your house that you have to go up and down? That might slow you down. Are you a smoker? That might also slow you down too. If you're able to just kind of be a couch potato for a while, that helps out tremendously in flaring that hip down. But once your hip is feeling better, you got to get up off the couch and start exercising correctly to fully resolve this problem. So I hope that answers your question, Pastor Winnie. Let me read the next comment here. Jude E. Baland. Hello. She said, I heard that people who have one knee replacement, that they will need a hip replacement within 5 years. I'm hoping I won't have to do this, as my knee replacement was 2 years ago. I'm so sorry, Jude. That happens a lot. And the reason is because of the muscle imbalances that are there. The same muscle imbalance that sets up knee arthritis and people having to get a knee replacement is what sets up hip arthritis, because those muscles cross both the hip and knee joint. They affect both joints. And just to show you how that hip muscle imbalance works, if you look at my skeleton here, this is the back side of the hip here. So the butt muscles are over here, and then on the front side here are the hip flexors. And those same muscles, the hip flexors, some of them end right here at the top of the thigh bone. There's one in particular called the rectus femoris, which is a quadricep muscle. It's one of the muscles right on the front of the thighs, that it runs down from this point right here all the way to the kneecap. And because of its attachment and the way that it works, it can affect both the hip joint and the knee joint down here and cause excessive pressure inside both joints. Then it's just a matter of which one's going to be affected first. It sounds like in your case, Jude, it was probably the knee. But if that hip muscle imbalance was never addressed, you had the replacement, obviously. So hopefully your knee's feeling better at this point. But you might still have that muscle imbalance, and it's setting up the next joint to be destroyed, to be arthritic, to over compress it and damage it over time. So the solution here is getting stronger in the butt muscles. That's typically the solution here. It could be abdominals as well. Sometimes there's issues to look down at the foot as well. But I would start with butt muscles all day. Most people have very weak butt muscles, and they could stand to get a lot stronger. And there's a cool reflex that once you start working the butt muscle and get it to turn on and work well and then get stronger, it actually begins to shut down, and not fully shut down, but more so calm down the quadricep muscles in the front, the ones that are acting like hip flexors. And it allows the pressures to be normalized at the hip joint and at the knee joint. And it causes you to use your body the way that it was intended to, so that you're not overloading these joints in your leg and your hip and in your knee, of course. So I hope that answers your question, Jude. If you're looking for exercises to start with, go check out that video that I mentioned earlier. It's in the link in the description below for hip exercises. We've got tons of exercises for knee arthritis as well. Go check out our playlists on our channel, and you can see them all organized there. You'll find one that says knee arthritis help, and that one's perfect for what you've got going on. And a lot of those exercises apply to hip problems as well, so you'll benefit from watching that as well. All right, next comment here, and then we got to get going here. Rosa Jaime says, hi. Hey, Rosa. And I can't pronounce this name. It's in a different language in English. I'm sorry. I only read English and Spanish. Hablo muy bueno español y puedo leerlo muy bien, for those of you that speak Spanish. So if you want to comment in Spanish, si quieres dejar un mensaje en español, te puedo ayudar. Hasta puedo darte una respuesta a lo mejor que puedo en español. I just said I can answer as best as I can in Spanish. All right, Rosa Jaime says, I have hip dysplasia, but no pain. What exercise should I do? Whew. Same thing. With hip dysplasia, that just means the hip joint it developed abnormally, and it's not as stable as a normal hip joint is. You have to compensate for your loss of structural stability with your muscles. In other words, get your muscles stronger so that you can get better stability at your hip joint. You've just got to go there. You need to have the goal, Rosa, of having the firmest, most muscular booty possible, not just for aesthetics, but for the sake of your health, so that you can tolerate walking as much as you want. So you're not dealing with arthritis later on in life. You just got to maintain good butt muscle strength. The gluteus maximus, medius, minimus, and all the deep glute muscles need to stay nice and strong the rest of your life. You need to just find out what exercises tire out your butt, get obsessed with them, increase your butt strength, and maintain it the rest of your life. If I had hip dysplasia, that's what I would be doing 100%. Pastor Winnie, thank you. It does. Great. I'm glad we answered your question, Pastor. And then we got Carmen Samaru. My knees. I'm sorry you're having knee trouble, Carmen. Jude says, thank you. You're welcome, Jude. And then Zainab Khan. Hello, Zainab. We've been seeing your comments on our videos. Thank you so much. You're saying, after 5 months of cartilage injury, I still feel burning sensation, especially at night. Is it unusual, or should I wait for healing? No, that's not unusual, Zainab. That means that you're overloading your cartilage somehow. Cartilage is an interesting tissue. It's designed to absorb pressures, but it can be overpressurized, and its metabolism, basically like how fast it heals and how fast it becomes damaged, it's not fast, it's slow. And so the effects of healing are much slower. You're talking 3 to 6 months or more, especially for a weight bearing joint like a hip joint. So if you had an injury 5 months ago, you need to track how much time you're spending on your feet, and notice if you're on your feet less, if you feel better in your hip, if there's less burning sensations in your hip joint, then that's a good sign that being on your feet less and less should allow you to heal faster. And then, of course, you have to play with it as the more time that you spent healing without flaring it up, then you eventually have to load yourself more. So you do have to spend some more time on your feet as you strengthen the muscle imbalances. Of course, that's the assumption here. Then you should be able to load the joint appropriately and allow it to get stronger. The cartilage will get stronger in a way that is going to benefit you for the long term. So I would wait if I were you. Of course, I don't know your life. I don't know what kind of pain you're dealing with exactly. If you're on pain medication, it might be a good idea for you to go get an injection, or to be on a pain medication, or maybe you need to go talk about getting a hip replacement too. But if you feel like you can back off your weight bearing more, like how much you're on your feet and walking around, then that will benefit you. It should benefit you, so that you can look at strengthening the muscle and balance for your hip joint to heal. So I hope that helps, Zainab. If not, please clarify here. I have just a few more minutes here, maybe 2 minutes. Jude Baland, el mejor. Muchas gracias. Carmen Samaru, my knees are bone on bone. The doctor say the only solution to my problem, I have to do knee replacements. Oh, we hear that so much, Carmen. Without seeing your X-ray and MRI, it's hard to tell you, what the situation is, and without knowing your full story too. The X-ray and the MRI. Let me just get on my soapbox here for a minute, because we see this all the time in the medical field. If your doctor hardly talks to you at all, doesn't know much about you, doesn't know what you do for a living, what kind of physical activity you're doing regularly, what kind of exercise you've done in the past or currently doing, or when the last time you exercised. If they don't know that information, and all you do is go get an X-ray or an MRI, and then the doctor's telling you need a replacement, I would raise my eyebrows tremendously, put the brakes on before saying yes to the doctor. Don't schedule a thing, and consider what's going on. Because if you have moments, even just one day a week where you feel fine, or it's not that bad, maybe you do have constant pain, but it ebbs and flows. Some days you have good days, some days you have not so good days. If you can find out what's making your good days good, and double down, triple down on that, rest more, or do more of an exercise that benefits you, figure out what makes your hip or your knee pain better, then you have a shot at healing, and maybe healing to the point where you can get back to doing what you want to do. And just a side note on that side note, healing is different from regeneration. When I see healing, you might get an X-ray a year from now and feel fantastic, having done all the right things, and you might still look like you're bone on bone on that X-ray, but you might be exercising, you doing stuff around the house, being on your feet for a long time before you have any problems. You might feel fantastic, even though the X-ray doesn't look that great according to the doctor or whoever's reading it for you. So that's what I would call a healed knee. Regeneration means that you're getting new cells in there, and that's not a thing that we are good at yet in the healthcare field. That's something that's experimental. You're talking like stem cell regeneration. There's other things too, but you have got to I'm coming back to you, Carmen. This is what I'm talking about. You have got to take the time to do the right things and exhaust all those options. Go look at our playlist on knee arthritis and see the exercises that you can do. Take the advice that we put on there, put it to the test, and comment back on our videos here and let us know, or come back on a live if you can and let us know how it's going for you. Because if you're not absolutely destroyed in your knees and you have some good days at least here and there, I would bet money that you could probably improve it even more and escape having knee replacement surgery. Now, that being said, you might be terrible. You might need to go get a knee replacement surgery, unfortunately. But put it to the test, try things out, and don't be afraid to get a second, third opinion if you need to when it comes to this procedure, getting a replacement surgery of any sort, because they are permanent and there's potential risks for these. Risks are getting lower as the years go by, but there's huge risks for them. And then, in my opinion, the biggest problem with getting a joint replacement surgery is that you're allowed to not fix the root problem, because the doctor doesn't ever talk to you about it. The doctor doesn't tell you that you got weak glutes. They just look at the x-ray, look at the joint, and say, I can fix that, which is great. That's what they need to be doing. That's their job. But it's not common knowledge to know that if the glutes are too weak, or if the quads are too strong, or if the foot muscles aren't operating correctly, then you're doomed to get the next surgery eventually down the line, because you never fixed the root problem for the first one. So you need to address that, please. I'll leave you guys with that. Thank you so much for joining us live. And if you're catching this on the replay, please drop a comment on here. We'll get back to it as soon as possible. Give us a thumbs up if you haven't already, friends, and we'll catch you on the next video. Bye-bye.